I've been asked to talk about this program whereby nurses, nursing assistants, and medical laboratory technologists are being sponsored to go and work in the US. So this process is free, and the agency take care of the bill to the tune of 85%. So the applicant will only meet some expenses when they are going for the immigration process, when they're going for the embassy, when they're paying for their green card. So if I talk about nurses, they are majorly recruiting registered nurses, and the only thing you're supposed to do is that you need to look for their website and submit your application. So these guys, they're only recruiting nurses who are working in hospitals with more than 160 bed capacity, and the hospital should be a teaching hospital. If not a teaching hospital, it should be a tertiary hospital. Then the nurse should also be working in acute area, inpatient area. The most preferred nursing specialty is medical surgical nursing. They also prefer those who are working in ICU. They also prefer those who are working in the accident and emergency area. They also take those who are working in the operating room. But these people are not recruiting for labor and delivery, and they're not recruiting for pediatric. So if you're applying from this specialty, you need to change whatever is appearing on your CV to reflect the specialties that are currently being recruited. The same condition also applies to the medical laboratory technologist. For you to be recruited as a medical laboratory technologist, you must be having a Bachelor of Science degree in medical laboratory technologist, and you must be working at an hospital with more than 160 bed capacity, and the lab you're working at should be like a referral lab, a very big lab, for them to give you this opportunity. And when we come to the nursing assistant, these guys are recruiting nursing assistant with a certificate, transcript, and recommendation letter from the hospital. You need to have worked for at least 6 months as a nursing assistant for you to be able to apply for this position. A nursing assistant can either be an healthcare assistant, patient care attendant, or patient care technician. I've also advised these are the people who do not have nursing qualification, like clinical officers, that they can also apply as a nursing assistant, but they have to modify their CV to reflect on their nursing assistant experience instead of focusing on their clinical officer experience. Then also enroll nurses, those nurses with certificate can also apply as a nursing assistant by only changing their CV to reflect their nursing assistant experience. Instead of writing that you've been working as an enrolled nurse, you'd rather write that you've been working as a nursing assistant. And the same condition like bed capacity, tertiary hospital, inpatient specialty also applies to this position of nursing assistant. So there are so many recruitment agencies that are recruiting this cadre of health workers I've mentioned, but being specific with the nursing assistants and medical laboratory technologists are currently being recruited by MedPro International. MedPro International is recruiting medical laboratory technologists, those who have Bachelor of Science degree. They're also recruiting registered nurses. They're also recruiting physiotherapists, and they're also recruiting nursing assistant. But O'Grady Payton only recruit registered nurses, and medical laboratory technologists. Other agencies like Avant, Interstaff, Kennedy Healthcare are only recruiting registered nurses. So, ladies and gentlemen, as I come to an end of this presentation, I just want to ask you all to go to my YouTube channel, kindly subscribe and watch all relevant videos that are applicable to the specialty you are representing. If you watch this video, you will get more insight on the process and you'll be able to learn a lot. And also, if you subscribe to my channel, you'll be able to get notification whenever I have posted any new article regarding this immigration process. Once again, I want to say thank you for giving me this audio.